In this episode of Ask Me Anything, I got a great question from a massage therapist about why I don't directly treat the psoas for low back pain and why I think it gets overemphasized too much for being the true cause of low back pain. What's up, everybody? Dr. Matt Mazur here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach massage therapists a new treatment system that focuses on working smarter, not harder, allowing them to cut their treatment times by 50% so they can stay healthy and help more people get out of pain. So back at it for Ask Me Anything. I'm going to read the question fully so you can get an idea of what's going on. It says, I went through several of your training modules on low back and hip pain and noticed you don't have much emphasis on the treatment and involvement of the psoas muscle. It seems like you are the only person out there teaching that doesn't address the psoas for low back pain treatments. Why not? Thank you so much for sending in that question, and more importantly for going through those training modules. I put those out there just to help people just think differently, focus on the idea of thinking critically and figuring problems out, and I'm glad you went through that. So the psoas. It gets way too much emphasis about the main cause of that. We do this as musculoskeletal practitioners. We want to fall into this trap of like the one thing fallacy of like this one problem is going to cause all the other problems there, and I only fix and work on these things. There's clinics out there that are actually called like the psoas treatment clinic. That kind of puts you into a pigeonhole and kind of keeps you in a tough spot from there. So we always want to find this one thing that's going to cause all this problem. You know, low back pain is going to be caused by the psoas. Shoulder pain's got to be the subscap, or it's got to be the fascia, or it's got to be the lymphatic system, blah, 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 blah. We can go down the list here and we want to isolate one variable at a time. Here's the thing, it's not like that. There's so many other issues and factors going on in the treatment process. What I'm going to link up here, especially if you're watching it on YouTube, is a webinar that I made going through the idea of like, there's more components to the injury than just one thing or one tissue specific problem. So the psoas. Do I treat it? Yeah, I do treat it, but it's not the first thing that I go to, and a lot of times I don't end up having to treat it as well. Usually what I find is a lot of the dysfunction comes from the posterior aspect of the spine, and this is where I'm talking like specifically like a low back sciatica type presentation. What I end up finding a lot of dysfunction is in the posterior part of the lumbar spine, specifically in the thoracolumbar fascia, the supraspinous ligament, and definitely the erectors, so like multifidus, iliocostalis, and longissimus group. They get overused and really get beat up from sitting too much, sedentary postures. They develop that scar tissue. I talk about scar tissue all the time. It's like glue that gets inside the muscle, makes the muscle weaker, less flexible, and these muscles are way more susceptible to scar tissue formation than the psoas, because the psoas actually gets a huge blood supply because it's coming right off of down through the core there, right where the abdominal aorta comes through. There's a very huge blood supply, and usually muscles that get a huge blood supply don't tend to develop as much scar tissue as muscles that don't, especially in the low back there. So another thing that a lot of people like to talk about is this lower cross syndrome. In all honesty, I talk about this all the time. Anything that has syndrome in it just basically means bullshit. They don't really know what's going on. They say muscles are tight, they're weak, they're inhibited. All of those don't tell us anything. The question you must continue to ask yourself and answer is, why are these muscles tight? Why are these muscles weak? Why are they inhibited? And a lot of times people aren't doing that. They're like, I'm just going to turn it on. I'm going to get those glutes firing. I'm going to get that psoas going. I'm going to do all this stuff. It's like, well, maybe the brain and the nervous system is really complex and it's shutting down those muscles for a reason. A lot of times to protect something in another place in the spine. You know what they're trying to protect? They're trying to protect the disc, because when the disc gets inflamed, causes issues, it pushes on the spinal cord and can mess things up. So tight, weak, inhibited is happening for a reason. And if you just fix the tight, weak, inhibited without actually figuring out what the problem is, you're screwed and you put your client and your patient in a really bad place. So why don't I treat the psoas? Because it doesn't usually need it. Maybe 5 to 10% of the time I will treat the psoas, and I do see that in people that have had some surgeries down there, or maybe women that have had a C-section. There is more scar tissue formation in there. I end up treating the iliacus and rectus way more. You know, iliacus right around the hip where it comes in and curls in there, and then I treat the superior attachment of the rectus way more. That tends to be way more dysfunctional because those muscles do not get as much blood flow as the psoas, and muscles that don't get as much blood flow are more susceptible to scar tissue formation. So get yourself out of that difficulty fallacy. You know, I see this all the time. It's like, I said it in the earlier part of the video. Well, it's real fucking hard to treat the psoas. It's really hard to treat the subscap, and I'm really, really good at it. And I'm like, okay, but that's not actually causing the problem. 90% of the problem is coming from other things, and you're focusing on the 10%. You want to be that difficult person, like, I am so good at treating the psoas. No one can treat it like I can. But here's the issue. It's not causing the problem. So you're getting good at something that you don't even need to do. You need to get better at other things. Get better at looking at the data, thinking critically, and finding out what the problem is. I want you to start by being a clinician first. Think critically, then become a technician. In manual therapists, we want to jump into treatment so quick. We don't even want to assess or know what's going on. We're like, I'm intuitive healer and I can figure all this shit out. Bullshit. You can't do that. You got to slow down. You got to ask questions. You got to figure out problems. So got a little ranty there towards the end, but that's how I am. So if you like the video, give it a like, give it a comment, give it a share. Go grab our free training. If you haven't got that yet, I really go into detail about critical thinking, figuring out what problems is, getting you to the idea of stop providing just a service and start providing a solution, because at the end of the day, the world needs more problem solvers and they need their injuries fixed. And the reason that I work and teach massage therapists how to do this, because you are the key to solving the pain pill epidemic. Because if we can get people good care on the front end, they can avoid pain pills, injections, and surgeries down the back end. And lastly, if you got any questions you want me to cover, send them in. Always here to help. I appreciate you guys, and I'll see you on the next one. Bye.